I'm going to bring Shaifali up to the stage. She's a transplant nephrologist from McGill, and we're really honored to have her here and leading the next session. Thank you so much. Thank you.
No break?
Thank you. I don't think there's a break. You go right in. Yeah.
Okay. All right, I'll just wait for my, okay, thank you so much. I want to thank the CDTRP to giving me the opportunity to moderate this session and present a couple of talking points, which are very near and dear to my heart. I'm a transplant nephrologist and I'm a health systems researcher based at MUHC. My research program is called Best Kidney Care, Building Equitable, Stronger, and Sustainable Health Systems in Kidney Care. That includes not just patients with kidney failure, but those with graft failure, as well as living kidney donors. Next slide, please. Do I control it? Oh, sorry. Okay. Here are my disclosures, and I have received research funding from these institutions that completely go to support my research program. However, I do get salary support from the FRQS, and I have received one speaking honorarium. So I just wanted to have two objectives that sort of tie in with the talks we're going to have. The first is to summarize the current state of living kidney donation in Canada, and making a point about that whatever research we do, we must not forget the living kidney donors. And why I say that, I'll present in a few minutes. So first, the state of living kidney donation. Starting presented the number of deceased donors we've had, but here is the number of absolute number of living kidney donors we've had in Canada over the past 10 years. And the numbers have stayed quite steady, except the COVID pandemic, around 500. So there have been a lot of national initiatives, and despite that, our numbers are not increasing. And this is not just the case in Canada, this is actually a global issue. Equally importantly, there are disparities in access to kidney transplantation, living donor kidney transplantation, and this is Canadian data. All of this. So the first two studies are a bit too old, where it was shown that when compared with white patients, Indigenous patients are 52% less likely to receive a kidney transplant from a living kidney donor. Indigenous children 64% less likely, and more recently, Dr. Mucci from University of Toronto showed that in Ontario, East Asian, South Asian, Black patients, and those with other ethnic backgrounds are this percentage less likely to receive a donor from a living kidney donor. And there are gender disparities in access to living kidney donation. In Nova Scotia, this work was recently published by Dr. Vinson, who showed that when compared with men, women had a 43% lower chance of being referred for a kidney transplant 1 year after dialysis initiation, 42% lower odds of being waitlisted, and 26% lower chances of receiving a kidney transplant once waitlisted. And this might be a sex-related problem, but the other two, there are both factors that are involved. And recently, an editorial came out following a trial that was published, a Canadian trial that was published by Dr. Garg, which highlighted this was an editorial, Solving the Kidney Transplant Conundrum Through Systems Thinking. And what I really thought was amazing was because this is what we've been arguing for the last few years through my research program and through that of Dr. Fartan, who works at the SHUM. And why did I say that? I started working in 2016. That was when I first became staff. And one of the things that was tasked to me was increase living donor kidney transplantation in Quebec, or at least in our center. And why was I told that? So Quebec is the second largest province in Canada. I'm an immigrant, so I learned this when I gave my citizenship exam, actually. I did 1 year of high school, but I didn't learn history then. So the total number of transplants are in these green bars, and then the number of living donor kidney transplants are in orange. And if you look at Quebec, only a fraction of kidney transplants that are conducted are from living kidney donors. So Quebec was one of the worst performing provinces when it comes to living kidney donation. And when I started, I was told that that's probably because we do very well with our deceased kidney donation rate, so which is not the case. And this is again older data, because this is what I used when I started out my research program. So a parameter we used to look at the living kidney donation and deceased kidney donation rates is the number of donors per million population. So obviously a province can be big, but if not many people reside there, we're not going to have that many living kidney donors. So what you do is you look at the number of kidney donors per million population. So that number, the national average is around 15. So in Ontario, that number is around 18.5 living kidney donors per million population. In BC, 19.5, and in Quebec, it's only 5 to 6. Over the it has increased in the last few years, but this has historically been the case. And the deceased donor rates are not that much better in Quebec, and so we have lower rates of living kidney donor transplantation because of other reasons, not because we do more deceased donor kidney transplants. And that's the number right there. We actually, at least in 2017, we weren't doing as well as some other provinces such as BC and Ontario. So again, I was tasked this job when I started, so I was like, well, what is BC doing better? And again, this figure just shows you the percentage of kidney transplants to total kidney transplant. In red is Quebec at the bottom, and BC is at the top in yellow. And one of my colleagues who worked in BC before starting in Quebec, she told me, she's like, the conversation is different there. And that comment was so fascinating to me. I'm like, how can the conversation be different? It's medical practice, it's the same thing, it should be the same thing. So that really fascinated me, and that's what I took on this project. So one of the first things we did was we actually went to healthcare professionals and we asked them, well, tell us, what do you think are the barriers to living donor kidney transplantation? And I think it may resonate for many of you who do living kidney donation, lack of communication between transplant dialysis teams, absence of referral guidelines, lack of information and training. But when I started looking at the data, I'm like, something about the BC is different. Like, people from BC were saying different things than people from Quebec, especially. So I took on qualitative research, but I know most of the world, for some reason, the research world loves quantitative data. They like numbers to support what they're saying. So what I did was I took those comments, I made them into a survey to sort of quantify these differences. And what I noticed was, so each of the themes that were identified in the qualitative work, I made statements out of them, and I asked people from all over Canada to take the survey. And then what I did was I compared the proportion of people who said they agreed or strongly agreed with the statement that this is a barrier to living donor kidney transplantation. So something like communication. There is good communication between transplant referring centers. Only 37% people agreed or strongly agreed. Like, there isn't. Most centers will tell you there isn't good communication between the transplant referring centers. But what I also did was I looked at the low performing provinces and the high performing provinces when compared with that national living kidney donor rate. And I used high performing provinces as a reference and compared how the respondents' answers varied. So most of these themes were barriers everywhere. But coming back to my colleague's point, how the conversation was different, there were some differences. So for instance, the transplant team is best suited to discuss living donor kidney transplantation. So people who are from lower performing provinces were 2.6 times more likely to agree with this statement than those from lower performing provinces. I initiate discussions about living donor kidney transplantation with my patients. People from low performing provinces were less likely to agree or strongly agree with those statements. So there is a difference. And coming to system level issues, my province actively promotes living donor kidney transplantation. People from Quebec and other low performing provinces were less likely to agree or strongly agree with those statements. Similarly, if I had more resources, I would discuss living donor kidney transplantation more with my patient. But delving deep into this, like I said, we started this approach that you need a systems approach to improve living donor kidney transplantation. You can't look at systems in isolation. That this is typically the trajectory of how we target our research. We target interventions to patients or care teams or organizations, but in the US, there was this approach proposed that we have to look at a health system comprising of these interconnected levels. They're nested, and when you do something here, it has more chances of success because it sort of impacts all of them compared to when you do something here. So I used this approach, and I did actually a case study analysis of BC, Quebec, and Ontario. Actually, I mean, my team did it, I didn't do it, but we got the funding. And so it was really interesting because I'll just share this figure, because this figure sort of just answers why the rates of living donor kidney transplantation are so low in Quebec. So here's BC. BC has a ODO, so BC Transplant, and BC has a renal program, BC Renal. They have a formal partnership. They have a joint mandate called Transplant First. So ODOs pump money and resources into transplant centers to direct human resources and other resources to increase living donor kidney transplantation. And the renal program, BC Renal, does that with the nephrology clinics. In Ontario, there is an ODO, there is a renal program. They have no formal partnership. They have historically, they don't have a mandate for a living donor kidney transplantation, the ODO. But there has been a recent, actually, not, it's not recent, it's been a few years now. There's a program called Enact LKD that has, we did this case study that a lot of people spoke very highly of it, that has the potential to improve living donor kidney transplantation a lot in Ontario. Quebec has no renal program. We actually don't. We only have Transplant Quebec, which historically has no mandate to increase living donor kidney transplantation. They're only involved with deceased donor. And we have recently come up with a program Québécois de Don Vivant, the RAIN, and that sort of directed that we got actually resources in our transplant centers. But as you may all know, that the process starts much earlier. We have to put in more resources into nephrology clinics and dialysis centers so that patients start contemplating about living kidney donation much earlier. So that's why I think we need a systems approach. But the other thing I would just want to mention is that we must not forget the living kidney donor. And why do I say that? This is a case of one of my patients that personally impacted me, because I followed this 82-year-old gentleman. He's now 82, but I've been following him since he was in his 70s, who got a kidney transplant from his son at the age of 36. And the son used to always accompany to his appointments. And then one day he didn't show up, and I asked what happened. Well, the donor had a hemorrhage. And he's okay now, he's going through therapy, but it really impacted me because I never asked how, I saw the recipient like 3 times a year. I didn't once ask, how are you, Mr. Living Kidney Donor? I can't say the name, but he actually had untreated hypertension. He lost his family physician, and in Quebec, we have a huge crisis, as maybe the case in many other provinces, that it took me 2 years to find a family physician myself. And so he didn't find a family physician, didn't really follow his hypertension. The cause of his stroke was uncontrolled hypertension. So this really, made me realize that we must not forget about living kidney donors. So I know I have a few minutes, but I'll just quickly state that when I started reviewing the literature, there's actually a lot in the literature that talks about all the unmet healthcare needs of living kidney donors. And I'm not going to go into all of this. I just want to show you how much data there is already, because and how much there is and how much there isn't. So there's a concept called Picker's Principles of Patient-Centered Care. So there are 8 principles of what constitutes patient-centered care, which are outlined here. And when we organize the existing literature by this, there is so a negative means that there is very little data to support what the patient's needs are perioperatively or post-donation, but there is some pre. And a lot of the focus is here, but the point that I just want to make with this slide is that there are a lot of, we don't know quite a bit about living kidney donors' healthcare needs, but even from amongst what we know, there are a lot of unmet healthcare needs. That was solicited data, which means that the researcher has a research question, and he or she or they ask that question to the living kidney donor, who then answers, and then we interpret. But when it's unsolicited data, meaning that the donor reports their own story, they control their narrative, the themes changed actually. So we did a summary of that as well. So similar themes emerged, like unmet healthcare needs, educational needs, but there were 2 very interesting ones that emerged, which didn't come when a researcher solicits the question. One was unanticipated outcomes of donation. We talk about financial neutrality. Many donors cited that there was some economic cost to donation, and the emotional burden, which is often not captured properly. And they want to contribute beyond the donation event. They want many of the donors who whose narratives we synthesize actually had an adverse event that they felt they maybe have not been properly informed about. So they feel like there needs to be a balanced perspective of donation, and they want to contribute to that beyond the donation event. We did undertake a prospective study that was done by my postdoctoral fellow, Dr. Sluminska, with the help of our patient partner, absolutely fantastic, Heather. And what we did was we divided a donation trajectory into 5 phases, and we looked at what the the key unmet healthcare need was at each phase. We had 49 donors participate, and the donors are very pleased with this part. They felt that during these phases there was adequate coordination of care within the donor transplant teams. But what they were dissatisfied with these phases, there was variability in not just the information that they received, but what they felt they needed to know. So not every donor wants to know everything. So the health seeking and the provisions vary by the particular living kidney donor. Huge gap, lack of continuity and poor coordination between care teams, and huge gap right here. Gaps in post-donation care accessibility and comprehensiveness. So we're trying to, and another one was lack of psychosocial support. There's a lot that is here that I won't talk about, but I just want to say that what needs to be done, and it ties very well with our next few talks, is that obviously we know the benefits of living donor kidney transplantation and it should be increased. But what we know is that we need system level approaches. We need macro, community, organizational approaches. We can't just do patient level approaches and we think that living donor kidney transplantation will increase, which will tie very well with one of our invited speakers. We know we need to address inequities in the processes that people have to, like, accomplish to access, to become a living kidney donor, and also for a recipient to access living donor kidney transplantation, which ties in very well with a talk that will be given by Hayden. And we know, and something I hope to talk about in the future, is that we need to improve the care and experiences of living kidney donors, because I feel somewhere we are like, okay, donate by. I think it has to be beyond that. Even donors want to contribute beyond the donation event. So that's with that, I will invite my first speaker. So